Hello, my name is Alexis Darn, and this is my final project for INFM 685. The title of this project is Comprehensive Community-Based Approach to Reducing Inappropriate Imaging, Data Exchange Between Primary Care and Imaging Facilities. So for the overview and introduction, we'll be looking closer into the Requirements Management Plan, the System Design Document, and the Test Plan. So before I move forward, I will provide an introduction to the test case. The awardees for the Healthcare Innovation Awards have been announced by the Center of Medicare and Medicaid Innovation, Altram Institute, United Physicians, and the Detroit Medical Center Physician Hospital Organization have all received an award to help reduce unnecessary imaging studies for beneficiaries in southeastern Michigan. This intervention is multifaceted and will establish a data exchange system between imaging facilities and primary care in order to increase evidence-based decision-making amongst physicians ordering MRIs and CT scans in the following areas: lower extremities, head, abdomen, cervical spine, chest, shoulder, and lumbar spine. The goal of this partnership is to reduce MRI volume by 13.4%, as well as reduce CT volume by 17.4% over a time frame of 3 years. This goal will result in a 17% reduction in the cost of imaging without any loss in the accuracy of diagnostics or test ordering restrictions. During this 3-year period, Altram Institute will train a network of area care providers in the use of the program's technology and systems, while also creating approximately 23 jobs for practice consultants, health information analysts, health education specialists, and lean practice redesign specialists. The Requirements Management Plan is necessary to establish how requirements will be analyzed, documented, collected, and managed throughout the project lifecycle. This Requirements Management Plan document will discuss roles, responsibilities, tools, environment, infrastructure, assumptions, constraints, requirements traceability, change management, and key terminology. This document will list the requirements necessary to ensure the success of the project and why we will need these requirements. This document is needed to assess the requirements needed for establishing a data exchange system between primary care and imaging facilities. In order to ensure its success, this document will take a look at the requirements for increasing evidence-based decision-making amongst physicians ordering CTs and MRIs. There is a goal of reducing CT and MRI volume over 3 years to decrease imaging costs. Requirements capture and communicate user needs satisfied and addressed in the product. Requirements are the basis for project estimates as well as project plans. They are the foundation for design, construction, and testing of the product. These requirements represent documented, non-functional, functional, and non-software needs that Altram Institute, United Physicians, and Detroit Center Physician Hospital Organization must satisfy. Requirements become the basis for the creation of various activities to include project schedules, testing, design, and implementation. In order to verify that requirements for this project are satisfied, verification must be done. Requirements management is important to ensuring project success. There are 3 things we want to avoid in the duration of the project, to include incomplete requirements, lack of user input, changing requirements, and requirements errors. The relationship between the stakeholders and project team will help avoid and alleviate these potential problems. The stakeholders are key regarding input and requirement defining and in understanding the priorities of the requirements. The requirements of the stakeholders involved in the development of this data exchange system will be able to make decisions and help control the project scheduling and project costs. Stakeholders will also be required to help set dates for completion. Stakeholders will be required to approve project changes, identify requirements, and identify constraints. Stakeholders are aware of the funding amount of approximately $8 million, as well as the estimated amount of savings totaling approximately $33 million. Stakeholders will have open visibility to all project artifacts. The role of the requirement specifier is carried out by the various individuals to include consultants and subcontractors, technical steward, software engineer, safety manager, stakeholders, project manager, project sponsor, and the business steward. Assumptions include funding provided at the beginning of the reward period. Project team will have access to materials and personnel needed to complete the project. Partnership between Altram Institute, United Physicians, and Detroit Medical Center Physician Hospital Organization will run smoothly, as well as ability to reduce unnecessary imaging studies for beneficiaries in southeastern Michigan. Constraints include a budget of $8 million, time frame of 3 years, estimated 3-year savings of $33 million, 3 years to train area care providers in use of systems and technology, and the creation of approximately 23 jobs for practice consultants, health information analysts, health education specialists, and lean practice redesign specialists. Multiple functionalities include data exchange system between primary care and imaging facilities, reduction in cost without loss in diagnostic accuracy, reduction of cost without restrictions on test ordering and reduction in unnecessary imaging for beneficiaries in southeastern Michigan. The purpose of this document is to describe the function of the data exchange system and reasons behind its development. This document will provide an overview and summary and describe the system requirements, environment, architecture, hardware, software, design, and interfaces. This document will adequately describe how the data exchange system will be constructed. The system design document identifies the system constraints, the points of contact relevant to the project, the system software, the system hardware, and the communications architecture. The system should provide capabilities to enable evidence-based decision-making. The local architecture should allow for resources and materials to be readily available to physicians when they need access. Resources and materials should also be stored in a way that will prevent them from being hacked. Physicians should only be able to gain access to patient records, materials, and resources by way of personalized and secure logins. The system should enable notifications for password entry and also password updates after 30 days. The system should allow for proper connection and access between imaging facilities and primary care facilities for proper viewing in a timely manner. All MRIs and CT scans should be clear and visible in order to provide the best possible quality care to patients. The system should be a high-performance system that is stable, functional, and reliable with up-to-date information. The system should consist of a network-connected, data-sharing, resource-accessible, enterprise-wide information system with hardware and software components, with the hardware architecture being a major key to include desktops, laptops, and tablets. It is imperative that all of these components have the same level of access to information. Physicians should be able to access imaging and resources from the desktops, laptops, and tablets. Connection should always be available as well to access resources and imaging as needed. So on this slide, I've included the model, and it's diving into the current workflow and revisioning what the new workflow could be. So next to number 1 is the current workflow where the patient visits the physician, and then a CT or MRI is ordered, and the physician provides a treatment plan for the patient via those results. Number 2 and number 3 offer a change to the system and a change to the workflow for the physician so that they can access evidence-based research in order to provide proper care without having to order a CT or an MRI. This test plan describes the test that will be conducted on the architectural prototype system and subsystem components. It is critical that all system and subsystem interfaces be tested, as well as the system performance in an early stage. Testing of system functionality, features, and capabilities will be conducted on this prototype to ensure it can handle the final functions of the implemented system. The following will be tested: local hardware, remote hardware, evidence-based resource features, storage, and data sharing. The most critical performance measures to be tested are response time for receiving evidence-based resources and material, response time for remote login to the clinical system, response time for internal login to the clinical system, response time for receiving MRIs and CTs, response time for ordering MRIs and CTs, response time to access evidence-based resource database, and system response time when multiple physicians and clinicians are logged in. The system will contain preloaded test data to be used for testing activities. And next, I will mention the major activities, techniques, and tools to be used for testing the designated groups of features: unit testing, system integration testing, performance and stress testing, user acceptance testing, batch testing, automated regression testing, and beta testing. The test milestones include test plan creation, test completion, defects logging, daily status report, weekly status report, test feedback received and documented, test closure report. It is important to note that these milestones are tentative and can change due to the following reasons: any issues in the system environment readiness, any changes in the scope of the project, and any dependency that may impact the testing efforts and project timeline. Risks will include the schedule, resources, defects, and the scope. In regards to the schedule, the testing schedule might be tight. The start of the testing is delayed due to design tasks. The test cannot be extended beyond the unit testing. For resources, there are not enough resources, or resources onboarding is too late. For defects, defects are found at a late stage of the test cycle, or defects being discovered late are most likely due to unclear specifications and are time-consuming to resolve. For the scope is completely defined. There may be natural disasters. There might be non-availability of independent test environment and accessibility, or delayed testing due to arising issues. And here I just have a chart of the risks that I stated, as well as the mitigation strategies, which are listed in the 4th column of the charts. The chart is a little bit longer than this. I just added some screenshots in between just to take a look at the resources and the mitigation strategies, as well as the probability of these things happening. And these are my resources. Thank you for your time and listening to my final project, and I hope that I exceeded your expectations in the report and in the PowerPoint presentation. Thank you.